Want a full smile makeover on vacation without waiting months? In Chiang Mai, Dr. Paul can complete a Hollywood smile in as little as 5 days.
So we capture the patient photos and then we make the internal scan.
Watch on as he explains the process, timeline, and follow up in the next 9 minutes.
My first name is Pawak, but my last name is Tungthangthum. So once when I need to introduce myself to the foreigners, I just tell them, please call me Paul. Paul is much more easier, and Paul is like Pawak, so it's much closer to my first name. I have been working as a dentist around 17 years. From Chiang Mai University, I went to studies in Chulalongkorn University about the dental implant and also the aesthetic restoration. So in terms of the aesthetics and the dental implants and the full treatment plan, I can handle all that type of the case. Moreover, I still learning after I graduated my master's degree. So I was trained in UCLA, Los Angeles, and from the OHSU from Oregon. And last year, I just went to Brazil for the training for the dental implants, justly for the full arch dental implant, like the on-4 or something like that. So it's look like the lifelong learning.
For cosmetic dentistry, it's the Hollywood smile design or digital smile design. If you can also share with us how the process looks like.
So in the past, we do many ways to do we use a template to make the mock-up on the computer, like the photo, something like the Photoshops to make it how it look like. But nowadays, we have more advanced technology. So we capture the patient photos and then we make the internal scan. Sometimes we also get the CT scan from the patients and we gather all that information together and we plan their smile in 3D, in like the full digital 3Ds. And we can render that smile design that suitable with their face, their smile width, and also the level of their teeth. And we can render and use the AI to make their photo in like the videos in reality, so they could see their new teeth when they're laughing, when they're speaking, when they're smiling, when they turn their face to left and right side. If they feel that shape, that smile look nice already, we will turn that smile into like the mock-up that we place inside their mouth, so they can have like the test drive to see how it look like on their face, on their smile, before we start to do the process, before they can get the real veneers, real work. So that is what we do nowadays. Actually, it's not take long time to do, but in each case, it's not just only like I throw all the information into the computer and the computer will throw the result out, but I need to adjust, choose, make the angulation, make the shape, like the sculpting, that's by myself. So sometimes it might take time to do that because I can do it just really like in the evening after I finish all the tests already in that day. So once I feel relaxed, I sit down on the desk and start to think, start to carving their smile. So that's why sometimes the patient, they ask that, why it take that long? I said, because all of this process is like handcrafting. So you cannot expect the good outcome if the artist being rushed to do some work.
How many days would it normally take? Like, let's say I want to do smile design. How many days should I stay in Thailand?
In shortest time, I can finish the case like from the preparation to the outcome in 5 days. So that is for like the full smile for the upper, fill all the gap in their mouth within 5 days. But I need to be honest that all the step, all the process cannot be like the same because I cannot have more time to sit with the patient and discuss with them that how they feel with this smile. But I need to jump in like, okay, I take a look, I take the photo, I take the mock-up and I decide in my head and I perform the preparation already. So the patient cannot have the chance to see how it look like before it's finished. They cannot feel exactly how it look like as the normal smile design process. Like they cannot see on the photo, they cannot discuss that they want to change. This teeth look more too young. This teeth, they want to have more sexier teeth, something like that. They cannot have a chance to do that. They cannot have the chance to tell me that they want to have two front teeth look like the Korean stars, but that is the design that I think that is good for them. But if they can allow me to have more rooms for discussing, for sculpting and alter the design, the outcome before we start. So they should have like around at least 2 weeks for all the process. It might take like a week just only for smile designs and discussion about how they feel this smile on the screen, how they feel this smile in their mouth before we start to shaping and cutting and fabricating.
Also, Doc, another part that's very important is the follow-up care, because as we all know, they cannot really fly as anytime as they could. But let's say they encounter concerns or challenges, how would they be able to like get assistance from you or from the clinic?
Normally we want to, as I told you before, that we prefer to have like a few days, 2 days at least after we deliver all the prosthesis or the veneers to make sure that it's working well during the function for that patient. Because sometimes, as I told you, it's like we cannot see that problem on the first day, but it might have that they might encounter that problem during some part of their function. So that is a way that we work things now. We usually make the follow-up appointment before the patient leaving. It's like if they have the teeth installed today and they need to go back home like tomorrow, at least I want to let them walking out, start to have some meals, start to get rid of the anesthesias already, and start to function and to see how it's work with that situation. But sometimes, even we have like a few days already, but the patient needs to leave like next few days. It's like after the surgery, even we feel sure that there is no infection at all. But the healing time state is not finished in 7 days. So healing time can be like a few months later. So sometimes the situation might happen after they go back home. So what we can do after that is like, I think most of the patients, once they have some concerns raising, they will send the email to us to let us know. And we prefer to have that things. If they feel that there's something wrong, if they're concerned on something, please let us know. So we can guide them. What is the situation? What is consequence that it could be, or it might be normal situation that they could expect during this phase of the healings, and what they can do next, what they can help that healings, or what they can make the outcome better, or how they can maintenance that things. So mainly we use the communication by email, and that is the reason that in some country that we have a lot of patients coming from. We also have the direct phone number in their country. So the patient can call us directly with their home phone, with their landline, with their mobile phone within their country. So they don't need to pay for the overseas charge for the communication. And that number will run directly to our desk, to our customer service.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.